This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Xemapixa 5 tablet is an anticoagulant used to manage blood clot formation effectively. It is crucial for individuals recovering from surgery or those with irregular heartbeats. Indications and uses. This medication is primarily indicated for the management of blood clots formed in the veins of the legs, the prevention of blood clots in heart patients with irregular heartbeats, and for managing the formation of blood clots following hip or knee replacement surgeries. It is also used to prevent the recurrence of blood clots in the legs or lungs, thereby reducing the risk of serious health complications. How it works. This medication works by blocking factor XA, a key component in the blood clotting process, thereby preventing the formation of clots and ensuring smoother blood flow. Directions for use. Take this medication exactly as prescribed by your healthcare provider. It should be swallowed with a full glass of water, and if you have difficulties swallowing, consult your doctor for alternative options. The dosage and duration of treatment will be tailored according to your age, body weight, and specific health conditions, so it is essential to follow your doctor's guidance closely. Possible side effects. Common side effects may include various forms of bleeding, bruising, anemia, and in some cases, low blood pressure. Patients should monitor their condition and report any adverse effects to their healthcare provider. Precautions and warnings. Patients are advised to exercise caution when taking this medication, especially those with kidney or liver disease, a history of bleeding disorders, or those who are pregnant or breastfeeding. A thorough consultation with a healthcare provider is essential to mitigate any risks. FAQs. 1. Is this medication a blood thinner? Yes, it is classified as an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any existing liver, heart, or kidney diseases. 3. What should I do if I forget a dose? Take it as soon as you remember, but don't double up. 4. Can it cause low blood pressure? Yes, this is a common side effect. 5. Is it safe during pregnancy? No, it is not recommended during pregnancy. Thank you for watching this video. If you have any questions or suggestions, please feel free to leave a comment below.